here we are. Good afternoon, Kyra, and good afternoon to the people that is watching and listening to us. So today I'm here with Dr. Kyra de Koninck, directly from the UK. Thank you, Kyra, for accepting my invitation today. I can't wait to have this conversation with you. So, Dr. Kyra de Koninck, I have here my notes. I want to be precise. Lecturer or sports and exercise science at Kent University in the UK. Fascia researcher, of course, founder and director of an ultrasound-based fascia research lab at the University of Kent, and members of the board of the Fascia Research Society. Right?
Yeah, what a lovely introduction, Laura. Thank you so much.
I'm precise. So, Kyra, 2 days ago, I decided to change completely, as I told you a few minutes ago, this conversation, because I was thinking to this. I was thinking to the, let's say, in medicine, in the medical environment, every time there is a big discover, something very, 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 very new, like a new, the cure for something, or a surgery technique, or whatever. It's an innovation. It's a revolution, both positive and maybe not really negative, but you know what I mean. And I was thinking that we are living exactly this historical moment. People like you and I, we are in the middle of a big revolution called fascia. And we are doing our best in our environment to tell to the world, hey, there's something called fascia, and maybe it's something that you need to know more about this, right? So that's why I decided to title this conversation, We Are Pioneer, because I think that we are pioneer, definitely. And so I have a question for you. The first question for you is this one. Let's say that someone is listening or watching us. Maybe this person doesn't know exactly what fascia is, okay? So it's a $1 million question, Kyra. Why fascia is so important?
Yeah, that's a great question.
Yes.
And it's important for a number of reasons, not only because it has been disregarded. So it has for centuries, anatomists and medical practitioners, surgeons have known that it exists. There are reports from surgeons from 1500, 1600, 1700 talking about particular suture techniques and how they need to take care of the fascia. How if the fascia becomes damaged, this can really delay healing after surgery. So we know that there has been an awareness of fascia when it becomes damaged. What I think is very new is that us recognizing and trying to understand the dynamic role of fascia, not just the role in healing and post-surgical fibrosis and so on. That's very, very important. But it has lots and lots of other roles, both in disease, in pathology, and in health and movement. And we're only just beginning to scratch the surface of that, really. What hasn't helped is that you just mentioned, whenever there is an explosion of new knowledge or there is a big discovery, there's kind of excitement, and then there's the fallout of the limitations and the poor research quality and everything else that then the critics kind of jump on. Mm-hmm. And fascia has been a victim of this, whereby when the first studies came out about fascia being a sentient tissue, about fascia having contractile properties, about fascia potentially being the answer to so many questions and to so much pain that patients have been suffering with and have not received an explanation for. Then the fallback, the flip side of this hope, was that it just wasn't quite forthcoming. And one of the reasons is because, of course, research takes a long time, and researching fascia in a healthy body is very, very complex. researching fascia in a pathology or a disease or a condition or pain is even more complicated. So it takes time. We're only just beginning to figure out what the best ways are to image fascia, to take images of it and to analyze those images, or how to analyze fascia using histology, looking at the tissues, looking at the types of collagen, looking at the molecular weight of the hyaluron, the fluid in between the layers. So we're still at very, very infant stages and in terms of research.
Yeah.
What I can understand is the frustration of many practitioners who want answers. And they want answers now because they have somebody who is in pain, who is suffering right in front of them. And they're desperate to help those people. Now, fascia is important because on the one hand, we have a very, very passionate, very active group of practitioners, both in manual therapy, in movement therapy, in lots of different practices and therapies who use fascia. They can feel the fascia with their hands and touch. They can feel the fascia in the movement or the movement restrictions of their patients and their clients. So we have these practitioners who have almost a real experience of the changes that they can feel and see and observe in their patients. Then we have the researchers. Quite often these people cross over. Yeah, we have practitioners who are also researchers, researchers that are also practitioners, but just for ease of comparison. Then we have a group of researchers. And of course, researchers have slightly different questions. The ultimate aim of that research is, of course, is to improve patient care, is to improve the quality of life for people. Absolutely the same aim that the practitioners have. But the way that those questions are answered is quite slow, needs to be really, really careful, and needs to be done in very, very controlled conditions. Whereas the practitioners are dealing with people, with whole holistic beings, with socioeconomic factors, with genetic factors, with families, with a whole entourage of elements which contribute to the pain, to the condition, to everything that these patients are experiencing within their fascial system and within all of the other systems in the body. We can't really separate it. When we're talking about the fascial system, we're talking about the muscular system, we're talking about the tendons, we're talking about the organs. So all of these systems interact, of course, with each other. That's the first really important factor of fascia, that it is not a standalone system, not like the urinary system or the respiratory system. Of course, those systems are interlinked as well, but the fascial system is completely interlinked with all body systems. And that makes it really complicated to research it, because in research, we need to literally peel away all of the layers that have an impact on the fascia to make sure that whatever it is, whether we're taking images, whether we're doing histology, whether we're doing biomechanical research, whatever research it is that we're doing, that we know that we are only working on the fascia. And in order to know that and to understand that, we are beginning to do that. And that's really where we have this gap, or where we have this imbalance between the results and the excitement that the practitioners feel when they are working with people with lots of adhesions, or people with myofascial pain, or people with post-traumatic stress, or hypermobility, or whatever it might be. Practitioners are experiencing that if they do something, it might not make any difference. If they do something else, it might make a difference. And really what practitioners want to know is, how do I help my patients? And right now, I think the only thing that we agree on is that fascia is important. But exactly what role it plays and exactly which treatment is the best treatment, we still don't really know, regardless of what people might say. And some things might work for some people, and other approaches might work better for others. And that's really where I think we have a common ground. And that's really where we need to try and speak each other's, understand each other's language, so that when practitioners ask questions, and communicate their findings with their patients, that they know how to do that in a way that scientists and researchers can understand. Because scientists and researchers do want to know about the patient experience and the practitioner experience, absolutely. But we talk in very, very different languages, and I think that's one of the really big challenges. So on the one hand, it's an important communication system within the body. It communicates with lots and lots of different bodily systems. So it's important in health, it's important in movement, but it's equally important in particular conditions and particular diseases that are still really, really poorly understood. So I see it as being important in health and in disease or poor health, because of its ability as a communication system, as a load-bearing system, as a adhesive system. You know, it can create adhesions and so on. So it's alive. It changes. It responds to stimuli. It responds to stress. It responds to not moving at all. It responds to moving a lot. And that's really the importance. I think I've just answered 4 different questions in one answer.
Absolutely, you touch so many interesting things, and I was thinking to something that I have written on my Instagram, and I said that we, people like me, we have to understand that very often fascia is the reason, because of the reason of pain in our clients, in our patient, and very often fascia is the answer, is the reason, the source, but also the answer. We have to understand this, people that do my job, for example. So why do you think, I believe, strongly believe that people like me, so movement practitioner, okay, Pilates instructor, yoga teacher, I'm also an indoor trainer, need to study more and more and more and more and more about fascia, because we know just the surface.
Yes, yeah, and also how it interacts with the muscular system, and how it is different from ligaments and tendons, and how loading bones, for example, what impact that has on fascia. So I think you're absolutely right that yes, very often it could be the cause of issues, and it could well be the answer to many conditions around, or experiences, for example, around chronic pain, or around hypermobility, or around edema, or lots and lots of conditions that we still really poorly understand. I don't think we can necessarily treat it in isolation, particularly around movement, because the fascia itself does not operate in isolation. It operates as part of the musculoskeletal system, amongst other systems. So I think that's something that's really important to bear in mind when we are using movement, when we are using loading, when we are transferring or using stretches, or whatever it is that we're using, that this is part of the other systems. It forms part of the skin. It forms part. Do you see what I mean? So because it's so easy to get to put so much how can I put this, to kind of put all the eggs in the fascia basket. Yeah, and I think one important thing is to remember that actually the real golden eggs are in understanding how the fascia works together with the muscular system. And I think movement practitioners on the whole are very aware of that, because of course movement practitioners work with movement, work with joints.
There is a big topic there is a big topic, education. We need the right sources, the right education, because fascia is very popular right now. So it's very easy to find articles or whatever, or websites or techniques, but they touch this topic just in the surface. It's it's happening. It's sometimes it's just fancy things, but we need serious researchers, serious resources, serious education, right?
Yeah,
This is important.
absolutely, absolutely. And I think what's really important is not to overclaim, is not to ascribe changes to the fascial system when in actual fact it could be the nervous system. It could be the joint capsule. It could be all kinds of things. We do not have X-ray vision. We can, when we're working with patients and when we're working with clients. But of course, that doesn't mean that we completely disregard fascia. It's an important and it's an integral system of the holistic body system and movement system that we have. Absolutely. And I do think that there are lots of claims being made about fascia, which are not always, which I think are grounded in experience. And experience is important. And experience, I think, sometimes gets trivialized and is regarded as somehow less, and that's a problem. Whereas I think what is important is that we recognize it as such. So when evidence is claimed, what's really important is that it's very clear as to what level of evidence this is. Is this a one case study? Is this the experience of one person? Is this the experience of one practitioner with 50 patients or clients? Is this or is this a randomized controlled trial? Is this based on a survey with practitioners? So these are all very valid qualitative pieces of evidence, and they are as valid as doing a statistical analysis of a histological analysis of a piece of fascia in a petri dish in a laboratory. They are as valid, but we can't conflate them. We can't, they're not the same. So they're as valid, but they're not the same. And that is, I think, for me, where the future lies, is to try and develop languages, both for laboratory-based research and for experiential-based research, and that we discover a language that we can talk to each other. And that's where nomenclature comes in. So that when we talk about superficial fascia, we know, for example, when a particular practitioner talks about superficial fascia, this is what they're talking about. If a biomechanist talks about superficial fascia, this is what they're talking about. I think it's too early to say that we're always going to use exactly the same language. We're not, because people are already using different terminologies. But what is important is that we understand each other's language, so that when we do talk about dense connective tissue or deep fascia or the perimuscular layer, that we understand that actually this is the same layer. So translating and understanding the level of evidence around fascia is very important. I think it's a strength, but it's also a complication, is that, of course, many people that are active in the space of fascia do so as commercial organizations, and of course have something to sell, and that means that it spreads and it's known by many more people, and many more people will now come and say, oh, well, maybe it is my fascia, and I have heard about my fascia. Is this a problem with my fascia? And this becomes a very maybe not trendy, but a very common issue that people might mention, particularly people in pain. And of course, now with social media as well, this information is spread. So I think that is very, very powerful, but it also has its limitations, because that way misinformation can be spread and overclaims can be easily spread. That doesn't just happen in fascia. Yeah, that happens in shampoo adverts. That happens in skincare, the hyaluron creams and the collagen creams. That misinformation happens in lots and lots of different fields. But I think because we are still so young in terms of research, it's the researchers are constantly trying to catch up with what's happening within the field of practice. So the practitioners are always ahead of what's happening in research. And that's a nice problem to have, but it's a challenging problem.
The things that I absolutely appreciate during the last FASCIA Congress in New Orleans was that for the first time you opened the door to people like me, so to the movement practitioner, because Fabiana told me, and she said, we know we have the research, the lab research, and then there are people like you that, as you said, every experience, a daily experience in your own studio with clients, and you know the things. Maybe you don't know the name, the name of the layers or whatever, or of the process, what happening exactly, but you know that it's happening because you see the results in your clients. And that was fantastic in yours, because and she said, we want to put together these two things, what happened in the lab and what happened in daily life in your studio.
And that's super, super exciting. And for me, that's where the future lies, in advancing our understanding of the importance, the function and the dysfunction of fascia. Absolutely. It's making that bridge, and that's not easy. No. That's not easy to do, because it is almost like people needing to learn, or at least learn to listen to another language, and learning to value that. But in the Fascia Research Society, as the Fascia Research Society, this is our mission. This is why Thomas Findlay and Robert Schleich founded the Research Society. It was to do exactly that, was to bring clinicians together and to bring researchers together. And of course, we have allopathic clinicians, medical doctors and physicians and surgeons and dermatologists as part of this conversation around fascia. But we also have complementary health practitioners who then speak a different language. And we have movement practitioners. So we have lots of different, and we have lots of, that's the same on the science side. We have lots of different researchers who normally don't talk to each other.
Very often, Kyra, I see but I mean the CV of people of the board of the Fascial Society. Very often they are both. They are like doctor, but also movement practitioner, doctor, but also osteopath. And this is fantastic. It's not common here in Italy. It doesn't happen, absolutely. But it's fantastic.
Yeah, absolutely. And we want to keep that. We want to keep that. We want to grow that, because it is so important to keep listening to each other and to understand and interpret and disseminate the research in such a way so that it is actually useful, that practitioners understand, even if you can't immediately put it into practice, that you understand, okay, so now I see why they were stretching the thoracolumbar fascia of this mouse to such a stretch, because that mouse was genetically programmed to be very flexible. And then I'm just thinking of something other than something hypothetical. And then this mouse was genetically programmed to be very stiff, but the fascia is being stretched as well. So this is, we might not completely be able to replicate this in humans, or it's going to take a few years before we can translate that into human studies. But these are beginnings, and these are first steps that will help us to come together. And I think some of the research, for example, the more mathematical modeling based research or the histological research, is so far removed from the experience that practitioners have. But the challenge for us is to bring it together and to try and help people to understand why that's still really, really important to do that mathematical modeling, or to do that histological research, or to look for particular gene expressions. Why that is still really, really important.
I don't want to be polemic, but Kyra, every big discovery or innovation, we said innovation impact also, we said in a positive way, but also in a negative way. So impact against ignorance, against resistance to the change, to the new, or envies also. What your experience? Did you experience this as a researcher, this resistance? Yes.
Yeah, absolutely. Yeah. So when I go to conferences, and my research is mainly ultrasound based, and when I go to sports medicine conferences, or I go to medical conferences, a lot of the feedback and a lot of the conversations I have is about, so where can we inject this? Or fascia doesn't really matter because it doesn't really do anything. It hasn't got its own contractile force. It sits there. It is a packing up, people still use that language. It is a passive packing material. And we just need to make sure that we do the right sutures after post-surgery, and then everything will be fine. So there is still a very within a lot of medical research and a lot of medical education, there is still very, very poor understanding, and that it might be something that's very, very big in the leisure industry or in the fitness industry, and that it is not something to be taken seriously. And that is still a belief. So that's not really based on any evidence, but that is a belief. So we have the practitioners with their belief system, we have the medics and the surgeons with their own belief system. And that is very hard, and that takes time. And that means that we are constantly making very, very small, I think with every physician, every surgeon, every medical practitioner who joins, for example, the Fascia Research Society, or who gets to hear about a fascia-related piece of research, all of this helps, because practitioner by practitioner by practitioner, we are slowly spreading our network and slowly beginning to talk to more and more people. But I am under no illusion. This is not easy. This is not hard, because we are up against hundreds and hundreds of years of a very Descartian, very Newtonian system way of thinking, of analyzing, of perceiving the body. So I liken it that we are on a very similar trajectory as cartilage. That's where I see. So when cartilage research first started 50, 60 years ago, it was, again, perceived cartilage doesn't matter. It doesn't do anything. It just sits there. It has a little bit of protection over the bones. There's no nervous supply, although it does cause a lot of pain. And then slowly, it was actually discovered that, oh my goodness, we can actually repair a cartilage, and we can do surgery on cartilage, and we can grow cartilage and then reimplant it. And cartilage is incredibly important. And that weight absorption function of cartilage, which was not really taken seriously, and increasingly, step by step, cartilage was kind of thought, maybe we should pay attention to that, and maybe we shouldn't just cut it away when it bothered people or when it caused pain. Maybe we should think about repairing it, because it is quite an important piece of anatomy. And I can see these kind of similar trajectories between the cartilage. So what cartilage researchers and what, for example, physiotherapists, massage therapists, movement therapists could see that their patients were really suffering with damage to cartilage, and that wasn't taken seriously, and that then slowly surgeons and other biomedicine research were making discoveries, because tools had been developed so that this could be imaged, so that they developed meshes, like little mesh material to grow the cartilage cells on, and cellular biochemistry really exploded in that period. So I can see that we've had lots of mini explosions. I don't think we have yet had like a big explosion in terms of, fascia research and fascia findings. And I think that's still coming, whereby we are going to make this a discovery which actually really explains that the process of this fibrosis and of these restrictions that we can see, that we can feel in fascia, and then how that fascia unwinds and how that fascia responds to different stimuli, whether that's somebody's hands, whether that's a stretch, whether that's a tool, whether that's a ball, whatever it is, and how that actually happens and how that interacts with the nervous system, for example. And that is something, that interaction, we still don't really know exactly the exact kind of physiology of that. I think once we crack that, that is going to get other people to sit up and listen and sit up and realize, okay, that makes sense now. And we're in this in-between phase.
And about this, one of the two biggest things, the most important thing for me during the last Congress, the two things that I took with me, okay? One was again from Fabiana. She said, take care of yourself, guys, not me, but guys, because it's true. But the other was that, when we teach and we strongly believe on what we teach. So, and we think that is the absolute truth, the Bible, okay? But what I learned during the Congress was that there are many other point of view, techniques, and maybe sometimes which we should be, also in this environment, absolutely we must be more open. There isn't one absolute truth, and we need to collaborate and listen to the other point of view.
Yeah, absolutely. I got that as well. And Fabiana Silva, the president of the Fascia Research Society, and all of the board members, this was something that we felt was so important at this particular Congress, that we build bridges and that we opened up the house to everybody, because we wanted to celebrate and we wanted to welcome the passion and the dedication that so many practitioners have, and very often feel unheard, feel that their voice is not being recognized. And one of the beautiful moments was when we could hear conversations between presenters taking place in the corridors of the Congress, and that was so lovely. And I didn't realize that actually you hold it for this many seconds, and we actually stretch it just a little bit further, or we find that blah blah blah, this temperature is very whatever it was. And it was just, and that's why we put the Congress on, to allow people to speak to each other, to encourage. That was one of the things we encouraged, actually, for people to go to a presentation that they knew nothing about, and to try and open that conversation. And we have plans to continue that, to use different formats to help that conversation in a very respectful and very open-minded and open-hearted way, for that conversation to continue. Absolutely.
Now, Kyra, I'm super proud, even if it's nothing, but I'm super proud to be part of the committee of members of the Fascia Society. So my last question, and then feel free to say and to add whatever you want, but my last question is why someone should become a member of the Fascia Society?
Oh, that is such a great question. To be kept up to date, to be kept up to date of fascia research, fascia practice, fascia experiences, which have been which have been interpreted and disseminated in such a way so that it's easy to understand. So, for example, in our newsletter, we always review a piece of research but then always try and get the clinical relevance. So what is the clinical? What does that mean clinically? And sometimes that's hard. And sometimes there isn't a direct clinical relevance, but we can still explain, because there is so much misinformation out there. So we see ourselves as the overarching voice to represent lots and lots of different voices. So it's not the aim of the Fascia Research Society to say this treatment is good and this treatment is not so good and this treatment is very expensive. Oh, it must be very good. This is not our role at all. But people are confused. Patients are confused. Practitioners are confused. So really what we would say is that our role is to try and clear up and be very clear and use easy to understand language. In terms of dissemination of research, we also want to support researchers, and we want to look at how can we support early career researchers to try and disseminate their research and to support them as well. Because of course we are constantly looking for the next generation of researchers. The researchers that are established are doing beautiful work and are doing amazing things. And of course, we will continue to disseminate them. And I've got some news for you about that aspect of what we do. But we are definitely also interested in giving a voice to young and upcoming researchers, and also to try and find ways and to develop ways in which we can support people, practitioners who are interested in research and want to do some research themselves, but don't know where to start. And that is something that we are in the process of developing. So first of all, it's education, it's dissemination of research, and then it's forming these different community of practitioners who are passionate about research, community of researchers that are often, like you say, practitioners themselves, but want to communicate their research to the practitioners. I think that sometimes that's something that people don't always might not realize, is that researchers are very, very keen to communicate their findings to practitioners and to patients as well.
Okay, we finish. I have another question for you.
Yes, okay. And I've got an announcement to make. I've got some news for you.
If you want, if you can, because I don't know. Do you want to tell us what are you working on?
That's exactly what I want to tell you. We are so excited about this. We are so excited about this. We have got a series of webinars. So these webinars were originally started way back in COVID. And then we have done a whole series on women's health, fascia and women's health. And now we are starting since the conference, we are starting with a news series. And the first speaker we have is on the 13th of December, and it's Professor Neil Thies. And we are so excited to present him, because unfortunately he wasn't able to present at the Congress. So he is going to talk to us about the fascial system and its interstitium. So he's going to talk about his studies. We recently reviewed one of his papers on our social media and in our newsletter as well. So that's the 13th of December, and that's at 6:30 in the evening, European time. And then on the 10th of January, we have Professor Carla Steckel. So Professor Steckel is going to talk to us, on the 10th of January. Okay. And that is again at 5 o'clock Italian time. And that's about the role of fascia in body perception. So again, something very new, really, really fresh research findings. In February, we will have Professor Gimberto is coming to talk to us, and his talk is called Fascia, Where Are You? Which I think is such a beautiful title. So we are kicking off this series of webinars with big names.
With two giants. Giants.
Absolutely. To kind of make a statement to say, look, this is the state of the art. This is where we are at. And then we will move more into younger researchers, and also researchers who might not think of themselves as fascia researchers, but researchers who research chronic pain, for example, researchers who research fibromyalgia, researchers who research Ehlers-Danlos. Classically, these researchers do not perceive themselves as fascia researchers, when in actual fact, a lot of what they do speaks to the fascial system. And I'm so excited about that as well. So we also have in April, on the 5th of April, we have Professor Robert Schleip, who is going to talk about fibrosis, force and flow. Again, fantastic title. And that is at 5 o'clock Italian time. And then on the 9th of March, we have Lara Bloom updating us on the latest research around hypermobility and Ehlers-Danlos. She's going to give us all the updates. So that's, again, very relevant to practitioners. So we are constantly striking a balance between, we want to update our members of the latest research, but we also want it to be clinically relevant. And that's a balance that we need to strike. And sometimes I think in the history of the Fascia Research Society, the dial has gone a little bit more this way, and then the dial has gone a little bit more that way. And we are trying to hover in the middle so that we build this bridge between these two very, very different worlds, who are both so motivated to make a meaningful change to fascia and our understanding of fascia.
You personally, in your fascia lab in Kent, what about you? What are you working on?
Yeah, so I am working on some movement studies. So we are looking at the gliding planes in different types of populations. So I've been working for a number of years. I've been working with a group of transatlantic rowers. So these are people that put lots and lots of loading onto their fascia. They row for periods of 40 days, 50 days. And recently I recruited a team of female transatlantic rowers. So again, very, very keen on including women in our research, because so much of the research is done on men. So we want to make sure that we include women as well in that research. I have a few modeling projects on the go. So this is whereby I am trying to create a model of what we term as non-specific back pain, or recurrent back pain, or chronic back pain. So this is pain that people experience, but there is no injury. So there's no damage to the tissues. And using different biomechanical methods, we are trying to replicate that. Because once we can replicate that experience of pain, we can then look and investigate on how that corresponds and how the fascia responds to that experience of pain. And for me, the really interesting meeting of two different worlds is that our understanding of anxiety and pain, and that the sort of experience that we have, and then the bodily experience of those fascial restrictions, and really where that lies. Is that literally, is that physiological? Is that the fascia, or is that the nervous system, or is that a combination of the fluids, the nervous system, and the dense connective tissue? So that's, for me, it's about understanding movement and its effect on fascia, and understanding the lack of movement, the fear of movement, and its effect on fascia. That's what I'm looking at. And I have a wonderful team of PhD students and master students. And it keeps me busy. That's the favorite part of my job, is supervising my students' research.
Okay, Kyra, it was fantastic. You are so passionate about this, about fascia. So it was a great conversation.
Thank you. Thank you so much. It was so much fun talking to you.
If you want to add something, feel free, do it.
Yeah, we have a new Instagram account, or Fascia Research Society _official. And join us, follow us. We have a new website coming up soon, fasciaresearch.org. So keep an eye on Fascia
many things
Research.
are coming up.
Yeah, Fascia Research Society on Instagram, on Facebook, and of course our website. Our new website will be coming out in the next few weeks. So we will announce that as well.
Fresh.
We have, apart from these webinars, we have lots of other ideas coming up, which we will announce.
Okay, Kyra, thank you very much.
Thank you so much.
But stay there. Okay.
Okay, thank you. Bye. Bye.